Cervical cancer has become the most common cancer affecting women in Africa. Significantly, 85% of these annual deaths occur in the developing world, with the majority being middle-aged women. Research has shown that in sub-Saharan Africa, cervical cancer trends are on the rise in the past 2 decades because of HIV, and this has resulted in an increase in cervical cancer cases among young women. However, little or no information exists that has shown that any of the available treatment methods are more effective than others when it comes to treating cervical cancer in HIV seropositive women. The aim of this protocol is to offer a plan on how to systematically review cervical cancer treatment methods available for HIV seropositive women in developing countries. Methods, design. The preferred reporting items for systematic reviews and meta-analysis protocols, PRISMA-P, statement was used to develop the protocol for the systematic review, which will be reported in accordance with the PRISMA guidelines. A number of databases, Embase, Midline, PubMed, CINAHL and Cochrane Library, will be searched for relevant studies, and citation and reference list tracking will be used to search for additional studies. Prospective and retrospective cohort studies, case control, randomized controlled trials and cross-sectional studies that were carried out in and for the developing world will be eligible for inclusion. Peer-reviewed studies and gray literature examining cervical cancer treatment modalities in HIV seropositive women will be included. Descriptive statistics and tables will be used to summarize results, and meta-analysis will be used where appropriate. Discussion. The review findings will provide the current picture of the existing treatment methods being used to treat cervical cancer in HIV seropositive women in developing countries. The findings might be used for the establishment of evidence-based guidelines for treatment of cervical cancer in seropositive women, as well as prompt policymakers and governments to decide and support future research in a way to find a lasting solution. Systematic review registration. Prospero CRD 4201705466. www.crd.york.ac.uk web link. Keywords. Developing countries cervical cancer HIV treatment. Background. Progress in the prevention and treatment of cervical cancer has been made, but challenges still exist in developing countries. 1, 2. Low resource settings are faced with challenges of financial resources, poor and non-existent health infrastructure, laboratories, cervical cancer screening centers, lack of technology and few qualified health personnel, mainly due to the brain drain. 1. These challenges, coupled with lack of proper epidemiological data, lack of knowledge and inadequate information on cervical cancer in low-resource settings, have created a major public health issue that is threatening to derail the progress made under the Millennium Development Goal, MDG, number 5, reducing maternal mortality and achieving universal access to reproductive health. The adverse effects of HIV in most low-resource settings have increased the burden of cervical cancer. 2, 3, 4, 5. Like most opportunistic infections, HIV seropositive women are at higher risk of HPV infection due to their immune-compromised status, with a risk 2 to 12 times more when compared to HIV-negative women. 3, 4, 5. Since current treatment modalities for precancerous lesions and cervical cancer are based on the stage of the lesion and available resources, the associated poor outcomes of treatment among HIV seropositive women in developing countries may be due to a lack of optimal treatment regimen. 6. Most developing countries lack skilled surgeons to carry out radical surgery for cervical cancer, and this has left HIV seropositive women with cervical cancer with few treatment options. In cases where surgeons are available, surgery is expensive and out of reach of many, who happen to be poor. 7. In developing countries, especially sub-Saharan Africa, many women with cervical cancer have no access to radiotherapy, further limiting their treatment options. However, little or no information exists that has shown that any of the treatments are more effective than others when it comes to treating cervical cancer in HIV seropositive women. In sub-Saharan Africa, Treatments like radiation therapy and other surgical procedures are not fully utilized because of lack of equipment and qualified personnel, hence little has been documented on which treatment procedures are being used for cervical cancer in HIV-seropositive women. 8. There is lack of evidence-based guidelines and strategies for screening, vaccination against HPV, prevention and treatment of cervical cancer in HIV-seropositive women in most developed countries. 9, 10. Coupled with this, there is little rigorous evidence on the global epidemiology of the treatment of cervical cancer in HIV-seropositive women. 8. Therefore, we aim to review the different treatment methods being used to treat cervical cancer in HIV-seropositive women in developing countries.